Doctor, always great to have you with us. So let's start right there with what Stephanie was talking about, children and the vaccine, because here's the thing. We're talking about this booster shot. Good news for a lot of parents, of course, but we also know vaccine rates among kids are low. So really for most parents, I'm not sure they're even at the point of the booster yet. So is there anything that can be done to bring those numbers up? What would you say to that?
That's right, Savannah. You know, what's interesting is that the booster has a 36-fold increase in antibodies, but of the 28 million children in this age group, 70% are still unvaccinated. So the challenge is going to be about getting kids boosted, yes, but also vaccinated in the first place. We know that the single most important thing parents can do is talk to their pediatrician. And like Stephanie suggested, we also really need to push for vaccinating kids under 5.
Let's talk about some global headlines here and the COVID outbreak. Let's talk about some global headlines here in the global COVID outbreak in North Korea. The country there has nearly 2 million suspected COVID cases. They call them fever cases, but it's refused help from abroad, turning down offers of vaccines from the UN's COVAX program and from South Korea. What worries you about this outbreak? And without outside help, can this country really battle COVID?
The situation in North Korea is likely to be dire, but Joe, like you said, these are secondhand accounts by state-run media. We know that North Korea has refused vaccinations from the COVAX program and China. They also don't have the medical infrastructure to support large outbreaks like medical supplies and ventilators. So we really don't know the true extent of what's happening on the ground, which makes it that much more worrisome.
Doctor, I also want to ask you about something else that seems pretty worrisome. It's this new report from the World Health Organization. It shows that the world is no better prepared for a new pandemic than it was before COVID-19. A big reason for that, it says, is vaccination efforts. But what did this study find? What needs to change? Were you surprised to hear this, that us dealing with this for 2+ years now didn't help us in this regard?
You know, Savannah, unfortunately, I wasn't surprised, and I was quite appreciated their strong language. The report starts by saying that COVID has really shown us how fragile and vulnerable our world is. And the pandemic has really shown us that there are many inequalities in the world, and they have been exacerbated. Here in the U.S., we had a 1 million death toll from COVID, and that's in spite of having vaccines early. In low and middle income countries, we're not going to see vaccines there until 2023. So think about that level of inequality. In spite of our pandemic burnout, which I know is deep for all of us, we do need to think about preparing for the next pandemic.
Doctor, I want to ask you, we're starting to see graduations, which means summer is upon us. And a lot of families are going to be heading out for summer travel, which we know is going to be huge this year. But we have these COVID cases going up. I was at the airport just the other day, not a lot of mask wearing in the airport, not a lot of mask wearing on the planes. Yeah. What's the best advice you have for families that want to travel, they want to get out, but they are worried about these rising numbers?
Yeah.
You know, Joe, I was on a flight just a few days ago, too, and I was shocked that people, you know, the large amount of people who weren't wearing masks. As we approach the summer months, graduations and warmer weather, try to engage as much as you can outdoors. If you are indoors, wear a well-fitted mask, an N95, KN95, and avoid cloth and surgical masks. The key is to wear masks, and I would love for us to have more masking policies nationally to mitigate the surge that's ahead.
Dr. Aditi Nerurkar, as always, we so appreciate your time. Thanks for joining us this morning.